You're sat at your desk trying to work and the information is not going in. You're reading the words on the page, but the information is just not being processed. Or someone's having a conversation with you and you zone out, then all of a sudden they ask you a question on something they were just speaking on and they realize you were never listening the whole time. Or you've got the idea in your head that you want to speak on, but you just can't seem to gather your thoughts to articulate it. Don't worry, you're not an idiot, you are just suffering from brain fog. And in this video, I'm going to explain every possible reason why. Brain fog is normal every now and then, but if you consistently have it, you're probably doing something wrong. And in this video, I'm going to explain what it is that you're probably doing wrong. We're going to start off with the more common reasons, and then we'll get into the more obscure ones later. The first most common reason is sleep. Sleep is like the bin man of your brain. So as you use your brain, it produces waste products. Now, side note, one of these waste products is something that's called beta amyloid. And this is linked with Alzheimer's disease. So that's just a little side note. So when you sleep, what happens is your brain shrinks and it pushes spinal fluid into your brain. And so as the spinal fluid is pushed through your brain, it drags with it all these little waste products and takes it out with it. And in that way, your brain cleans itself from all of the waste products it produces as you use it throughout your working life. Now, if you get a good night's sleep, the bin man can collect all of the rubbish that's lying around. But if you don't, there's still going to be some that's lying around that's getting in the way and stopping you from being able to think to your full capacity. Now, when you sleep, you also consolidate your memories and the things that you've learned during that day. Now, there's two types of sleep, and that's REM sleep and deep sleep. So you've got REM sleep and deep sleep. So we're going to focus on deep sleep first. So what deep sleep does is your brain. You have two structures in your brain. Okay. This one is your prefrontal cortex, and this one is your hippocampus. Now, when you sleep, your brain transfers your memories from your short-term storage, which is in here in your hippocampus, to the long-term storage in the cortex. And the role of REM sleep is to link your memories with emotions, and your memories are much stronger when they are linked with emotions. So if you are not getting enough sleep, you are missing out on the two things that I just mentioned. So moral of the story, make sure you're getting enough sleep. Brain fog is just one of the many issues that can happen when you don't sleep properly. So make sure you're on top of that. Now, your diet might also be the reason why you have brain fog. So you've got your blood sugar and you've got your time. This is a little graph that I've drawn. So when you eat something, let's say it's 12 o'clock, it's midday, you eat and your blood sugar rises as the food is digested. Then along here, this is where insulin is released in your body, and with insulin, the role of it is to transfer the sugar from your blood back into your cells. So when this happens, your blood sugar levels then fall, but insulin overcorrects and it reduces your blood sugar levels too much. So this right here is the optimal level that you want to be at, but when the insulin drops, it makes your blood sugars go a bit too low. And this section here is your food coma stage, is the feeling that you get when you demolish a kebab and you're just tired and you just want to sleep and you can't do anything. A car needs the fuel it was built to run on. You can't put Pepsi in a tank and expect it to run properly. So what are some examples of good fuel for your brain? Fish, blueberries, nuts, whole grains like porridge, avocados, turmeric, dark chocolate, eggs, and green tea. And make sure to stay away from sugary foods and drinks because they can spike your blood sugar, like I just described. And stay away from things like refined carbs like white bread and pasta and processed fast foods. When you don't eat properly as well, you also get nutrient deficiencies. So you'll have a lack of essential vitamins and nutrients and minerals that your brain needs, like vitamin D, vitamin B12, iron, omega-3 fatty acids, which is very important, and magnesium. So I'm going to focus on omega-3 because it's crucial for a process called neuroplasticity. So in your brain, you have millions of neurons. So I'm going to draw a neuron. Now, these are two neurons, and every time you learn something, these neurons form little bridges between each other, and they form little connections. And so the more you learn something, the more you revise it, the more you go over it over and over and over again, the stronger these little connections build. So the more you revise, say you're revising for days, then weeks, then months, then years, and you do something enough times, then eventually these two neurons get fused together, and this right here would be a strong memory. Now, when you don't get enough omega-3s, the connections between your brain cells can become weaker, and the neuroplasticity process, which I just described, doesn't happen as effectively. And then that manifests itself as brain fog, poor concentration, and poor memory. The next reason why you might have brain fog is because you might have hormonal imbalances. So to any woman watching this, have you ever noticed how your mental clarity changes during different phases of your cycle? So for example, during ovulation, you might feel sharp and energetic, but a week before your period, you might feel like your mind isn't as sharp. So a lot of women experience this, and that happens because your estrogen and progesterone are basically playing tug of war in your brain as you go through these hormonal fluctuations. So it's not just around your monthly cycle that you can experience this, it can be at any other time that your hormones are imbalanced, like in pregnancy, menopause, or if you're taking birth control. Estrogen, the role of it is that it protects the brain from damage and promotes the growth of new brain cells. It also has an influence on the hippocampus, which we described earlier, which means that you can't form memories and learn as well. Now, progesterone mainly affects your mood stability and has a calming effect on your nervous system. So low levels mean difficulty sleeping, which has all the effects that we described earlier, and generally just makes you anxious and stressed, and it's much harder to think when you're anxious and stressed. As for the men, you might be having brain fog from low testosterone. The hippocampus, which we described earlier, has a lot of testosterone receptors, so when you don't have enough testosterone in your blood, it can't function as well. It also affects the blood-brain barrier. In your brain, there are lots of these blood vessels, millions and millions of these, and so we're going to focus on this one here. Now, around each of your blood vessels, there is a barrier. And this right here is the blood-brain barrier, this area here. So in your blood, there are certain toxins. And so this barrier here stops these toxins from getting out of your blood and into your brain. Now, sometimes, for example, when you have low testosterone, the barrier can become damaged. And then this allows these toxins to travel through these damaged areas and get into your brain. Now, when you have these toxins inside your brain, it causes inflammation, and so you can't think as clearly, it causes issues for you, and you have brain fog. And low testosterone also means that you can't sleep as well, and when you can't sleep, as we described earlier in the video, it causes all of the other issues. You can't recover, you can't store your memories, and you can go back and check it again if you need to. Brain fog could also be caused by thyroid hormone deficiency. So low thyroid hormones can lead to difficulty concentrating and memory issues, mainly because it slows down your metabolism. So your metabolism is your body's ability to turn food into energy. So if your body and brain are not getting the energy that they require because they're not making enough, then you can't function at an optimal level. So if you do have thyroid issues, then you might also experience symptoms like weight gain, feeling cold, fatigue, and dry skin. So you might also have issues with your insulin sensitivity. So this is the graph that we drew earlier. It's going to be similar to that, except that this time when you eat, the blood sugar goes up, and then where the insulin is meant to come here, your body is less sensitive to the insulin, so it doesn't work as well. And so your blood sugar might be corrected a bit, but it's not going to be enough, and it's still going to be higher. So what that means is that the sugar is not going into the cells of your body, including your brain cells. Your brain's not getting the sugar that it requires to function, and so you can't think as clearly. So if you do have insulin sensitivity or pre-diabetes, you'll have symptoms like feeling thirsty all the time, feeling generally tired, and needing to urinate a lot. The next reason is mental health. So brain fog is a not so well known symptom of mental health conditions like anxiety and depression. So when you are anxious and stressed, your body releases stress hormones like cortisol. These stress hormones are useful in short bursts, like if you're facing a real danger. They can make you sharper, but when they're constantly elevated, they can start to interfere with the brain's ability to think clearly. You'll have a cognitive overload where your brain's experiencing or expecting potential threats, leaving you unable to think clearly. Try to remember a situation where you've been scared or under high pressure. You'll realize it was very difficult to think in that moment. Now imagine that on a smaller scale, but every single day, constantly. Depression is linked to reduced neuroplasticity, as we mentioned earlier. There is less serotonin and dopamine in a depressed individual, which are your feel-good hormones, and your hippocampus and frontal cortex, which we described earlier, require these serotonin and dopamine hormones to function properly. So when there are less, there are issues with learning, remembering, processing new information, and this leads to brain fog. The next reason is burnout. Your brain is a muscle and you need to treat it like one. The same way your chest will get fatigued and you wouldn't be able to do another rep if you worked it long enough in the gym is the same way that your brain gets fatigued and doesn't work as well if you've been working all week. You know that it wouldn't make sense to train the same muscle group intensely multiple days in a row, so you shouldn't keep your brain working intensely every single day. You need to schedule in some downtime. You need to have some time in the week where you don't touch work or business or studying or whatever it is that you do, and just give your brain time to recover. And I know some of you watching this are probably thinking that you have this mad goal that you are trying to achieve and you're so busy and you don't have time to stop. But the downtime is going to come whether you like it or not. Whether it happens on your own terms at a time that you have scheduled and are comfortable with, or whether it happens because you're so burnt out from overworking yourself that you don't have the energy to do anything else, it is going to come. Now, I understand that you may have these goals that you want to achieve, but if these goals are as big as you say they are, then they're not going to be achieved in a week or a month. They are probably going to take a couple months or years to achieve, so you need to pace yourself accordingly. You're not going to win a marathon by sprinting the whole time. You need to go at a steady, maintainable pace. Now, you can train your muscles to build endurance and work harder for longer, and you can also do this with your brain. But you need to take it slowly and you don't want to load yourself too much. You want to have a structure to it and do it in the same way you train your muscles, with sets and reps. A good way to do this is the Pomodoro method. I myself was a massive skeptic of this at first, but it actually does work. So you would work for 25 minutes, then rest for 5, and then after 4 cycles of this, you would have a longer break. If you do this on a long enough time scale, slowly building up the intensity, before you know it, you will see massive gains in your brain's focus and endurance, and you'll be able to work for so much longer. I found that I was able to work so much longer for so many more hours in a day when I did this, instead of what I used to do, which was sit at my desk for like 3 hours and just burn myself out and not have the energy or the cognitive power to be able to do anything else for the rest of the day. In a nutshell, it works because you force yourself to use your brain like a marathon runner and not a sprinter. Another reason is you might have underlying infections. So when your body fights an infection, it reacts by releasing inflammatory chemicals called cytokines to fight off whatever it is that's making you sick. But these same chemicals don't just go to the area of your body which is infected. They stay in your blood and they can travel up to your brain, causing brain inflammation. This inflammation can interfere with how your brain normally functions. Your neurons can't communicate as effectively and you may experience symptoms like confusion, poor concentration, and feeling mentally exhausted. There are so many types of infections that people can have without even realizing. You could have nasal congestion and headaches, which most people ignore because they're pretty common symptoms, but they are actually a sign of a sinus infection. Or you might have some fatigue and bloating and some slight indigestion, but this could be a yeast infection in your gut, or you might have a H. pylori infection in your stomach. Another reason is medications. So you might be taking some medications that are causing you these issues. Antidepressant medications cause brain fog and they can affect your serotonin, which we explained your brain needs. Painkillers like cocodamol and codeine can make you drowsy and slow. Medications for heart issues like amlodipine, propranolol, and statins can reduce blood flow and oxygen to your brain. And when your brain doesn't get the oxygen it needs, it's not going to work as effectively. Also, hay fever medications like Benadryl can cross the blood-brain barrier, which we described earlier, leading to mental confusion and drowsiness. If anything that I've mentioned in the video sounds familiar, please do not hesitate to click the link in the bio to use our free symptom checker. You can check all of your symptoms and you'll be asked questions based on these, and then from there it can give you some potential diagnoses and just some general guidance on your health and what your next step should be. Click the link in the bio.